Hello everyone, this is a video about PANDAS and whether a person with ADHD or anxiety might be misdiagnosed with those conditions and actually have an issue with PANDS or PANDAS. Just before I jump into the content of the video, as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to obtain that advice. So someone posted a question on one of my other videos and it says, can you have PANDAS for a long time and be misdiagnosed as ADHD/anxiety, but those meds don't work that well? How does a person get diagnosed with PANDAS? So thank you for the questions. PANDAS, for folks who don't know, it's the cutest acronym of all time for a condition that's really, really tragic and awful for those that are afflicted by it. So it's an acronym for pediatric autoimmune neurodevelopmental disorder associated with streptococcus, so like the strep throat bacteria, basically. There's another version of that called PANS, which is the exact same issue, just it's triggered by something that's not the streptococcus bacteria. It's by other things like other infectious microbes or maybe toxins or maybe potentially traumatic brain injury or something else that might cause a lot of neuroinflammation. And as I just alluded to there, PANS or PANDAS is characterized by a lot of neuroinflammation, which can cause a lot of psychiatric symptoms, a lot of physical symptoms. It can be just really, really awful and devastating. There can certainly be a lot of overlap between ADHD and anxiety and PANS symptoms. A lot of folks with PANDAS/PANS will certainly have anxiety. It's a very common symptom that's associated with PANS or PANDAS. And then as far as ADHD, if it's issues with focusing and hyperactivity and things like that, then that's certainly something one could see in PANS or PANDAS as well. I mean, it's definitely possible that a person might be misdiagnosed with anxiety or ADHD, and it actually is PANS or PANDAS. PANS or PANDAS generally, like kind of classically, has a fairly typical kind of clinical pattern, and that it's something that comes on fairly rapidly after some type of infection or some other type of issue that causes neuroinflammation. So like classic example would be say there's a pediatric, so child. So a child has they're developing beautifully, they're neurotypical, like just doing great, and then they get a strep throat infection, and then after that they develop these physical tics. They become really anxious. They kind of develop OCD. They might start bedwetting out of the blue, which is essentially like a bladder tic. Might become just completely impossible to manage. They're like flying off the handle all the time. And so it's like, oh, they had strep, and like very shortly after develop all these, really intense symptoms. That would be, a pattern where like, yes, a clinician might come along and say, oh, I guess they're just anxious. But if they know anything about PANS or PANDAS, they'd think, okay, this is something that's really relevant. Like this came on after a strep throat infection, or, could be, oh, this, child had Lyme disease and, had the bullseye rash and this and that, and went on antibiotics, but despite treatment, developed certain, neuro psychological symptoms or whatnot. So generally there's a pretty common like classic pattern like that, although that's not always the case. There certainly seems to be some slow burn types of PANS or PANDAS cases. And then as I know I've talked about in other videos, and certainly other clinicians have talked about this as well, it seems that there is this kind of adult version of PANS or PANDAS where when folks have certain constellations of symptoms that look exactly like PANS or PANDAS, but they happen to not be pediatric, or I've treated some patients where they develop PANS or PANDAS, say when they're 15, and they don't get appropriate treatment until they're in their early 20s, and the symptoms don't just magically go away when you turn 18 or whenever you're I mean, depending on some definitions, 16, you're no longer pediatric. And anyways, a birthday doesn't erase, these symptoms, unfortunately. So they're in my clinical opinion, like in my clinical experience and in my opinion, I think that there are adult versions of PANS or PANDAS, just they need to kind of be renamed as something else because pediatric doesn't apply when you're an adult. There could be a person who has what appears to be classic ADHD, classic anxiety symptoms, pediatric or adult patient, and it's possible that they might have PANS or PANDAS as an underlying component of that, or that might be the main thing that's going on. It would be very uncommon for that to be the case, but it certainly could be the case. A person not responding to the medications for ADHD or anxiety doesn't mean that it must be something like some something like PANS or PANDAS or something else. It's just sometimes meds don't work. It's like, yes, it is ADHD, it is anxiety. The medications just aren't working because they don't work for everybody, unfortunately. So whether a different medication would work better or a non-pharmaceutical approach would work better or whatnot is sort of a question mark and maybe a topic for another day, for another video. But I would certainly say PANS or PANDAS could be on the differential diagnosis list, but depending on the other clinical features of the patient's case, it might be like really, really low on the differential diagnosis list, or it might be, mid-range, or it might be very high on the differential diagnosis list. So it would really depend about the clinical features of the patient in question. So I hope that gave you some information that's useful about this. It's kind of a complex topic, but those are my thoughts on that part of the question. The other part of the question was, how does a person get diagnosed with PANDAS? So there are diagnostic criteria. I don't remember the website off the top of my head, but if you plug PANDAS diagnostic criteria into a search engine, you should find a website that comes up pretty high in the search rankings. And again, I can't remember what the website is off the top of my head, but they have these diagnostic criteria that have been set out for PANDAS anyways. And so there's certain symptoms and clinical features and things like that that would sort of be that would be the diagnostic testing for that. With that being said, if you read through those diagnostic criteria, you can see that there's quite a lot of leeway, and ultimately it really is a clinical diagnosis at the end of the day. There's some supportive testing that can be done. So there's something called the Cunningham panel, which is basically a test panel of about, I can't remember off the top of my head, I think it's around like 10 10 essentially autoimmune antibodies, basically antibodies against different components of brain tissue. And that's something that can be tested in folks who have, or kids who have PANS or PANDAS, or maybe adult patients who have kind of the adult version of PANS or PANDAS. They would have one or more of those antibodies lighting up. And so that's a test that can be done, but it's not specific to PANS or PANDAS. Other neuroinflammatory conditions, autoimmune neurological conditions could also manifest with those antibodies being elevated as well. So to my understanding, there's no definitive diagnostic test for PANDAS or PANS. There are diagnostic criteria, and they kind of give clinicians a guideline to have a sense of whether or not PANS or PANDAS might be on the table, but there's not like just one simple blood test or something like that tells you, oh, yes or no, you have PANS or PANDAS. So again, thank you for the questions. I hope that that information was useful. If anybody has any comments or questions on this topic, please post in the comment section below. Or if you have comments comments or questions about anything else, feel free to post in the comment section below, and I'll do my best to answer the questions or maybe respond to the comments as soon as I can.